I graduated as a baccalaureate degree nurse in 1994, and I went to work in med-surg at New York Hospital. When I was 6 months into my nursing career, I decided to per diem at the Visiting Nurse Service of New York, and I started that, and I absolutely fell in love because it was one-on-one, it was patient-centered, there were no call bells going off. And I could do a whole lot of patient teaching, which is the focus of VNSNY. During the time that I worked at VNSNY, I went back to Pace University and became a family nurse practitioner, and they were nice enough to fund that for me. And I graduated as a family nurse practitioner in 1998. When I left VNSNY, I went teaching part-time and also working as a nurse practitioner in a mobile wound care facility. I would do mobile wound care in the community. So again, one-on-one, patient-centered, patient teaching. Until I was offered a permanent teaching position in 2004. So that lasted from 2004 to 2011, where I was offered this position, and I moved here. Again, still my focus is community health nursing, health promotion and prevention. And last week I finally, after 8 years of study, achieved my PhD in nursing. Well, my personal philosophy on teaching is if you give someone a fish, they eat for a day. If you teach them how to fish, they eat for a lifetime. I like teaching because I'm able to touch patients in a very, very different way, because everyone I teach touches patients, and therefore you pay it forward. And I like teaching people how to engage in what I think is the best career in the whole world. I mean, nursing gives you the ability to work almost anywhere, at any hour, in any place. And I love nursing that it's able to elevate people, their socioeconomic status, their social status, their ability to branch out and expand and be leaders. So I look at nursing as just such a wonderful, wide opportunity for anyone who goes into it. So being able to teach someone that passion, it excites me incredibly. I think I'd like my students to transform themselves as a result of my teaching to really be a health promotion agent. I'm very, very big on being proactive versus being reactive. And if I can teach that to my students and they take that out into the world, I think that will probably be the biggest agent of change. Because if you can prevent something from happening, you're so much better off than if you react to something happening. So managing, preventing high blood pressure, first of all, through diet and exercise would be the primary goal. Okay, so if you have high blood pressure, let's prevent the complications of it through medication, diet, and exercise and lifestyle. Fine. Okay, if you have high blood pressure and you already had the heart attack, how can we make you go through rehab and diet, exercise, and medication so it doesn't happen again and it's not a fatal event. So using the primary, secondary, and tertiary prevention components to make the very most of every day. That's how I'd like my students to touch their patients, and then that pays itself forward too. What do I like to do outside of teaching? Well, if you were to ask me one thing no one would ever know is I actually raise chickens in my backyard. So when my daughter was really little, we got eggs in an incubator, because I never did this in school. And they do it in the schools now. And so we got an incubator full of eggs, and I hatched 8 chickens. And I was supposed to hatch them and bring them back to the farm. And I fell in love with them. And I actually was allowed to keep them in my backyard where I live, and I've raised chickens ever since. And so that's something different that I do that wouldn't be associated with nursing in my spare time.